If my mother had breast cancer, does that mean I'll get it too? Does wearing an underwire bra cause breast cancer? You may be wondering whether these statements are true or false. And so in this video, I am going to be busting 5 common myths surrounding breast cancer so that you will know the truth and will put these rumors to bed once and for all. Hi, my name is Dr. Tasha and I'm a breast cancer surgeon. If you're new to the channel, welcome. If you want to learn more about all things related to breast cancer and health, consider subscribing. So without further ado, let's get some myth busting out of the way. Myth number 1. Does wearing a bra with an underwire cause breast cancer? And the answer to this is no, it doesn't. And I think this stems from a claim made about 20-30 years ago where it was thought that women who wore tighter fitting bras with an underwire have an increased risk of developing breast cancer compared to those women who don't. And it's thought that the tightness of the bra causes an obstruction of the lymphatics in the breast, causing an accumulation of toxins that can lead to breast cancer. And the consensus is that this is not true. The most recent study, somewhere here, I'll link it, looked at the relationship between various bra wearing habits and breast cancer risk in postmenopausal women, and the conclusion is that there is no association between bra wearing habits and breast cancer. So this myth is not true. Second myth, do deodorants cause breast cancer? Again, this is not true, and I think there is a debate about whether deodorant with aluminium causes an increased risk of breast cancer, and there has not been any evidence thus far to suggest that there is a link. If you go to have a mammogram, you are normally recommended not to wear deodorant, and that's not because of an increased risk of breast cancer development. It's really because the deodorant itself can be highlighted on the mammogram that might mimic something that we need to be concerned about. So deodorant use can actually interfere with what a mammogram looks like, and that's why we recommend you not wear a deodorant. But otherwise, deodorants are absolutely safe and there is no link between deodorant use and breast cancer risk. Myth number 3. Does an injury or trauma to the breast cause breast cancer? And the answer to this is no, it doesn't. If you fall onto your breast or knock your breast, the natural thing to do is to examine your breast, and you might feel something not quite right, either some lumpiness or a lump, and you might take yourself to get it checked out. I see patients in clinic all the time who have unfortunately fallen, knocked their breast, and the majority of the time there is nothing wrong or nothing is found when we examine their breast. Very occasionally though, we would find something that might have already been there even before the knock or the fall had happened. So injury or trauma to the breast in itself does not cause breast cancer. Number 4, if your mother had breast cancer, does that mean that you will get it too? The answer to that is not necessarily. I hear people come through the clinic saying that, my mother had breast cancer at the age of 40, I'm now 39, I'm really worried about it because, I'm nearing 40 now and maybe I will get breast cancer just like my mum. And I can totally understand the concerns with that and the anxieties that come with that. Totally understand that. But the truth is, the majority of breast cancers actually happen sporadically. It just happens. There's no rhyme or reason. Only 5 to 10% of breast cancers are actually hereditary, so the majority just happen. Why do they happen? It's multifactorial. We can't really necessarily pinpoint the reasons why it happens, but the greatest risk of developing breast cancer are actually being a woman and getting older. So if you do have a family history of breast cancer, it doesn't mean that you will get it. However, it's quite important to assess your own individual risk of getting breast cancer. And so perhaps if there is a strong family history of breast cancer in the family, you may want to go to your general practitioner or family physician to ask to be referred to your local breast unit family history clinic to get your risk assessed. But just because your mother had breast cancer doesn't necessarily mean that you will get it as well. And myth number 5, do breast implants cause breast cancer? And the answer is no, it doesn't. There is no associated link between breast implants and breast cancer. However, there is a link between breast implants and a T-cell lymphoma, which is a cancer of the immune system, called BIALCL, and that stands for breast implant associated anaplastic large cell lymphoma. A bit of a mouthful. As of 2019, in the UK there have been about 59 cases, and worldwide about 600 cases with 33 deaths. The incidence of this condition is about 1 in 23,000, but research is happening every day, and so this figure might change. The good news is that early BIA-ALCL is curative, and it's important to know what the symptoms are and what you need to look out for. So if you've had a breast implant, you need to look out for any swelling, any seroma, that's a collection of fluid, or any masses or lumps in the breast. If you get any of these symptoms, then please get them checked out. But in terms of the myth that breast implants cause breast cancer, that is not true. So I hope you've enjoyed this video. If you would like to learn more about breast cancer and health, then do consider subscribing to the channel. And in the meantime, take care, and I'll see you in the next video.